All right, so sternocleidomastoid, again, SCM is the name we use for this. And I think the name of sternocleidomastoid is pretty straightforward because in its name are its attachments. So the sterno refers to the sternum, where it attaches up front here on the sternum. And the cleido refers to the clavicle, also an insertion point. And then the mastoid refers to the mastoid process behind the ear where its origin is. So SCM. As you know, I like to go in the order of OIA because it makes the most sense if we understand where the muscle starts, where the muscle attaches or goes to understand the movements that it can do. So again, this one's pretty straightforward because the name's right in it. But if we start at the origin, traditionally written in red, we have the origin, we have the top of the manubrium, the sternal head. So the top of the manubrium. So the sternum, right, is the breastbone or the chest bone right in the middle. And it has three sections. And the top part is called manubrium. And then the big middle part is called the body. And then the lowest part is called the xiphoid process. So it attaches, like the name sternum, sternocleidomastoid, but the top part of the sternum is called the manubrium. So that's why we have manubrium here. It's just part of the sternum. And then the clavicular head attaches on the medial third of the clavicle. And both of those are very palpable, so if you want to feel on yourself right now, right at the little, kind of divot at the middle where your clavicles come together, right at the top there. And if you feel actually coming down and trace your sternocleidomastoid down, then you can feel where that attaches. And then on the clavicle, on the medial third, again, if you walk your way down, your big sternocleidomastoid, and then you go with flat fingers side to side. Right there on your clavicle, you can feel the ropey muscles. And if you tuck your chin or flex or laterally flex to the same side, all of those movements, and the rotation, you can use all of those motions to make that sternocleidomastoid kind of a stick out. But right behind those landmarks, of course, are vulnerable and nervy areas. So that's why we're using flat fingers and really going across those bones, not digging deep with that. So those are the origins. Interesting thing about sternocleidomastoid that, I can see right here in its, both actually its origin and its insertion, is that, interestingly enough, the sternocleidomastoid, embryologically, so in development, was actually one muscle with upper trapezius. And it's later on that they separate into two different muscles. And so both, how they share this clavicle as an attachment, right? And the traps, upper traps, come all the way to the lateral 2/3 of the clavicle. And then up here on the mastoid process, where it goes back to the nuchal line, that is continuous with the trapezius as well. So I think those connections are interesting. Because it kind of shows you also just how these muscles work together, and if one of the two is tight, hypertonic, or has trigger points, etc., or is injured, or etc., then the other one is likely to be as well. Then our insertion, we have the mastoid process of the temporal bone and the lateral portion of the superior nuchal line of the occiput. So this is quite an easy bony landmark to feel. I mean, you've all felt it at some point, but if you go posterior to your ear, And again, you can use flat fingers and feel around. There's a big bump back there, and that's your mastoid process. And then if you just continue to feel posterior to it, and then as you're on the inferior aspect of it, you can really feel the SCM come right down off of it. Questions on the O or the I?
I just wanted to say, when we were just palpating that behind the ears, it made me feel almost nauseous or kind of headachy.
Uh-huh.
Is there a reason why, just that might be really tight region back there?
Uh-huh. It's possible that you have trigger points as well. You know, some of the trigger points in sternocleidomastoid can cause headache-like sensations or headaches. And actually, some of the trigger points can have interesting sensations in addition to just pain. And some of that can actually feel like dizziness or nausea. So it's possible that was a trigger point reaction, but you know, I don't know if you have something else going on as well.
Can I ask one more question?
Yeah.
When you said the sternum, I just, for my own knowledge, want to know this, the Manubrium on top, the body, and what did you say is below?
The xiphoid process.
Oh, yeah.
So I'll type those words over here on the left. So the sternum has 3 parts. The top part is the manubrium. And that's the part where the SCM attaches. And then the big middle part is the body. And then the inferior part, which kind of sticks out, it's a small and pointy. It's the part when you're doing first aid CPR, you know, you want to be careful to be above that and not press down on it, is the xiphoid process, which my brother thinks would be a cool name for a band as a random addition to that xiphoid process. All right, so we got the O and the I. So actions. Unilaterally, of course, means if we act one side at a time. So let's say our right sternocleidomastoid fires, we can laterally flex the head and neck to the same side. So ear to shoulder. We can rotate the head and neck to the opposite side. And bilaterally, both sides at the same time, we can flex the head and neck, and we can assist to elevate the rib cage during inhalation. And as I mentioned, this muscle very commonly gets trigger points, very commonly is tight. It's an important one to massage. Now, a couple very important massage considerations. You know, the carotid artery runs in this area. So whenever you're massaging the sternocleidomastoid, you're always, you know, aware of the feeling under your hand, under your fingers. And if there's a pulsing sensation, you want to move off of it, of course. Because this is a vulnerable area and also has the carotid artery nearby, I always massage just one side at a time of sternocleidomastoid. So if I'm massaging a posterior neck, I definitely will often work bilaterally. But once I get as far forward as the scalenes and the SCM, I only massage one side at a time. So the other hand, right, could be supportively under the occiput and whatnot. We will practice this next week with the thoracic outlet lab on Monday. But for now, I'd like to walk you through a couple things, and it's a really good muscle to practice on yourself so that you can get comfortable enough to massage it with other people. Because for a lot of people, it can feel a little scary at first to massage people here. So first of all, I like to grasp part of the muscle with kind of a curved flat finger. So I'm trapping the muscle between a curved flat finger and my thumb. And so you're making like a squeezing motion, but this base of the finger is kind of like a base. And you can work your way squeezing up and down all the way from the mastoid process, all the way down to the sternum. And as you felt, you can actually feel the sternal head and the clavicular head separately. Now, with the motions that the muscle does, right? Lateral flexion of the head, rotation to the opposite side, flexion of the head, practice those movements, because you'll notice that depending on what part of the sternocleidomastoid you're on, some of those movements are going to kind of make it easier for you to feel the muscle and really get your fingers all the way around it. So you should literally be able to grab that muscle between your fingers, like it was like a hamburger or something. So you're literally grasping that belly of SCM, and you're working your way up and down. Now, the thing about this that sort of takes patience and practice is that there can be trigger points and adhesions kind of all the way up and down. And so you really want to practice also, once you've got a hold of it, then rolling your thumb and forefinger back and forth patiently. And you might, even try like a lateral flexion to the same side, kind of puts it on some slack. And then when you're at a certain level with it, really roll your way through the tissue. Now, of course, if you feel pulse underneath or nerve sensations, obviously you're going to move. But this really takes practice, because what you might notice is that in some places you can grab it, in other places it kind of wants to roll away from your fingers. And you want to get to the point where you can roll through the tissue, because if you just quickly squeeze, you're not going to find all the trigger points and adhesions and so forth. Now, if you practice one side, go ahead and practice the other now. And really practice rolling your way through the tissue. And of course, your muscles are having to hold the weight of your head up. So another thing I like to do when I practice neck massage on myself is it's also really good to practice when your head is supported. So like on a sofa or a bed with a pillow or a chair with a backing on the head. So you can practice sitting up, but it's very valuable to practice when your head is rested as well. And really take the time with this one, because it's going to make the difference between how quickly you get skilled and comfortable doing this with a client. And this is a crucial area to get skilled at, and probably one of the areas that people tend to be the most tentative with at first. Are there any questions? All right, so keep practicing that on your own time, like even throughout the weekend. If you're watching TV or something, just keep practicing that, and you'll be a lot better when we work with each other on Monday.